Hi, my name is Dr. Megan Fay, and today I'm going to be talking to you about misophonia. I'm a psychologist who specializes in the treatment of anxiety disorders, obsessive-compulsive disorders, and eating disorders. One of the diagnoses I specialize in is called misophonia. This video is intended to provide information about what misophonia is, and in future videos, I'll cover how to receive assessment and treatment for it, as well as dive into specific tools for building tolerance to trigger sounds and regulating elicited emotions. These videos were created as an educational resource and are not a replacement for treatment. I recommend finding your own provider who can help meet your individual needs. So let's get into it. What is misophonia? Misophonia is an intolerance or distress reaction to certain sounds that varies based off of who is making the sound or the situation the sound occurs in. Common sounds that people struggle with are chewing, sniffling, throat clearing, heavy breathing, popping gum, tapping, and knuckle cracking, just to name a few. But sound triggers change from person to person. Some people with misophonia also react to visual triggers, such as seeing someone jiggling their leg or tapping their pen, even if they can't hear the sounds. If you struggle with misophonia, you're probably listening to this list and cringing just thinking about these sounds. The most common response to misophonia trigger is anger or rage. However, there can also be feelings of disgust or anxiety, especially when anticipating that a trigger may be about to happen. Often people initially try to deal with triggers through avoidance tactics or through efforts to stop the person who is making the noise. While this might create immediate relief, it can actually play a role in worsening misophonia by amplifying sensitivity to those sounds, as well as amplifying the intensity of the emotional reaction to those sounds. Misophonia is a psychological condition. It is not a medical or audiological condition. In the next video, I'll discuss how to get proper assessment to understand if you have misophonia or another condition. One of the key psychological features of misophonia is that the distress or anger reaction to triggers is based off of who is making the sound or the situation the sound is occurring in, rather than every time the sound is experienced. For example, most people with misophonia find the sounds their families make to be the most disturbing, but they may not be bothered by friends or strangers. This suggests that it's context dependent and derived from psychological interpretations of the sounds rather than based off of how your ears themselves are processing the sounds. This will be important when discussing assessment resources in the next video. For many people, misophonia starts to show up in adolescence and worsens as time goes on, typically beginning as a reaction to select people, such as parents, and spiraling outward to include more people and situations over time. One psychological theory for how misophonia originates is that people with misophonia may have a pre-existing sensory sensitivity to a certain type of sound, or have had a specific past negative experience with that sound, and as a consequence, begin to avoid situations where the trigger might take place, or begin to associate that sound with a certain set of people to be avoided, or endured with anger. This often creates what is known as a conditioned response to that type of sound or to the people connected with making the sound. Families are common first stressors because they are also the people we spend the most time with, and therefore we have more opportunities to experience their sounds. They may also bear the brunt of the anger or distress reactions because they are safer to get upset with, whereas many people will be more effortful about regulating emotions around strangers or friends. Avoidance of triggers can actually strengthen the distress those triggers cause, as well as reinforce avoidance behaviors as a strategy. While avoidance might feel effective in the moment, it robs us of the opportunity to learn how to cope with those triggers. This can become problematic as your world gets smaller and smaller due to avoiding social situations or important experiences, and can often lead to strain in family relationships. Common avoidance tactics include avoiding meals with other people, wearing noise-canceling headphones, using white noise machines, or wearing earplugs. research on people with misophonia actually shows that wearing earplugs to block out sounds can have the opposite effect of increasing sensitivity to those sounds. So how do we treat it? That is a very important and complicated question. Misophonia is a relatively newly recognized disorder, and treatment research is actively being done as we speak. It's possible by the time you watch this video, new information will have been learned about what works best in helping with treatment. Currently, misophonia is considered an obsessive-compulsive disorder because it shares many psychological traits and characteristics with obsessive-compulsive disorders, as well as seems to respond to interventions that are commonly used to treat these disorders. The interventions that I will cover in my videos are tools from therapies called cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavior therapy, which are all evidence-based treatments for symptoms of anxiety, OCD, and for building skills of distress tolerance. These treatment approaches have also been found to be effective for improving symptoms of misophonia in treatment research. Thanks for tuning in to today's video. Check back soon for the next video in my series where I'll cover how to receive appropriate assessment for determining whether you have misophonia or may be experiencing a different diagnosis. In the meantime, I've shared a few links below for receiving information about misophonia, including a blog I wrote summarizing many of the key points covered in this video. If you found this video helpful, please rate and subscribe.